Welcome to the MamasteFit YouTube channel. In this workout, we're going to be doing a back mobility flow to help release tension that you may be feeling. So if you're having upper back pain or you're having lower back pain, we're going to go over a few exercises to help you find some relief. For this mobility flow, we're going to need one weight that's like a medium to light weight for you. We're also going to need a long resistance band that's attached to a wall. So if you're using the wall or your door frame, you can use a door anchor, but I'll give you an option on how to do it without an attachment as well, but you will need a long resistance band for that. We'll also need one yoga block. And so as soon as you have that equipment of the weight, the long band, and the yoga block, we'll go ahead and get started with today's back mobility flow so that you can feel more comfortable as you navigate your pregnancy and into your motherhood. And if you enjoy this workout, be sure to subscribe to our channel so you get notified whenever we release new videos. We release new workout videos every Tuesday. And then if you want more, we do have our online prenatal and postpartum fitness programs that you can join and feel strong throughout your pregnancy, pain-free, and help prepare for motherhood. So let's go ahead and get started with today's mobility flow. So we're going to start down on the floor with our yoga block. With this exercise, I'm going to place one knee onto the yoga block, and we're going to move through some hip shifts with some thoracic rotations. So coming into a tabletop position, I'm first going to shift my weight over towards that elevated knee so I can lift the other knee off the floor without really changing my body position. And then I want you to think about your rib cage position as well. Can we shift our rib cage over to that elevated side also? So almost think like this rib right here, we're kind of pulling back a little bit to where you can lift the opposite hand without having to shift your position around. And then from here, we're going to drop belly down to the floor, look forward, and then exhale to round in your back, pull belly to spine, and that's what's helping you to round. So inhale, belly down to the floor, exhale. We're going to do about 10 pelvic tilts here. In this hip shifted position, we're going to be moving the posterior pelvic floor. So we're improving how well the pelvis is moving on the femur. We're creating some space right by the sacrum in that back half of the pelvic floor, where a lot of us tend to have a little bit more tension. One more here. And now come to that rounded position. The same side that as of the elevated hip, you're going to reach up towards the ceiling and then back down to the floor. Drop belly to the floor, round in the back, and then reach up to the ceiling. So we have this hip shifted thoracic rotation. We're going to do 10 rotations on this side, and then we're going to move to lifting the hand, and then we're going to switch to the other side. So sometimes if we're having discomfort in our back, it could be that we're not moving enough. Maybe we're stuck in positions, which is pretty common throughout pregnancy and especially in the postpartum. So finding more movement in the spine can sometimes really help to relieve discomfort that you may be feeling. We'll do one more. Now I want you to put weight into the elevated knee and into that elevated hand. And we're going to shift the rib cage over towards that elevated side and then lift that opposite hand off the floor and then place it back down. So we're going to lift that opposite hand and back down. This is helping to strengthen the abs just a tad. It probably won't be super challenging in the core, but it may be a little bit hard to lift that hand if your weight is not really shifted over. So ensure that your weight is in your knee, is it in that outside hand. Rib cage is shifted over to the left, and then lift the hand. We'll do about 2 more. And now we're going to lift the bottom knee up and down. So weight is still shifted over. We're going to drive that up knee up and then place it back down. Legs are staying fairly parallel towards one another. Last one. And now let's switch to the other side. So we're going to place the opposite knee. I'm placing my right knee onto that yoga block. We're going to shift our weight over towards that elevated hip. So you may feel a little bit of a stretch in that glute. And then make sure we shift the rib cage over as well. So you can lift that opposite hand off the floor. You can lift the opposite knee off the floor without having to change your position. We'll move through those 10 pelvic tilts, so belly to the floor. Exhale, round, pull belly to spine. And same thing, these pelvic tilts in this hip shifted position, because we get this question a lot. Why are we using a yoga block? This is helping you to move a little bit deeper into the pelvic tilt, a little bit deeper into that pelvic floor. So you're going to feel a little bit more of a stretch towards kind of like that hip pocket area. We'll do one more, and then take your time with these as well. Now keep that rounded position. We're going to reach up to the ceiling for our twist and then come back down, drop belly to spine. So we're adding a rotation with our pelvic tilts. Weight is still shifted over to that elevated knee. We'll do one more. And now we're going to do our hand lifts. So weight is in the elevated knee. Rib cage is shifted over as well to that opposite hand. And then we're going to lift the hand off and place it back down. We'll do one more. And now the knee, so drive the knee straight up to the ceiling and back down. Thighs are staying parallel towards one another. We're going to have a little bit of a round in the back here. What's happening here is the pelvis is rotating on top of that femur, so we're improving pelvic mobility here, which can really help if you're having any discomfort in like the hips or the lower back. So we're bringing the pelvis to a closed and an open position. Two more. Last one. So go ahead and place your yoga block to the side. And now we're going to do a few strengthening exercises to help, especially with the upper back. If you're having any like shoulder discomfort, maybe some neck discomfort, sometimes we're not looking for necessarily a bigger stretch, but a little bit more strengthening. So we're going to start on our back and we're going to grab our one dumbbell. And it should be like a medium-ish weight for you. And so this is going to be relative. You may find that one weight is like the perfect for you. That might be different for somebody else. So we're going to start by straightening the opposite leg. So I have the weight in my left hand, right leg is straight, and then I'm going to bring my left leg to this 90-90 position. Right arm is out to the side. And now I'm going to roll to the right as I push the weight up towards the ceiling and then roll to my back. Exhale to roll and press. Inhale to roll back. So what this is doing is it's changing how my shoulder and my scapula are moving with one another, increasing the mobility with a little bit of weight. So this is going to be really great if you're having a little bit more discomfort in your upper back. For me, this was like a really common area that I have more discomfort with like my baby. We'll do 4 more. Last one. Let's go ahead and switch to the opposite side now. So left leg is straight, weight is in the right hand, and then right leg is up. Left arm is out to the side. So I'm going to roll to the left as I press that weight up towards the ceiling and then roll to my back. And so again, this is moving my shoulder and my shoulder blade around to improve the mobility in relation to one another. So if we're having more of that upper back pain, it could be that we're kind of limited in shoulder mobility. Maybe the scapula is not moving very well on the rib cage, and that could really contribute towards a lot of that shoulder and upper back or even neck discomfort. So this is like one of my favorite exercises to do to help when I'm having more of that shoulder or upper back pain. One more. Go ahead and bring that weight down. And now we're going to come onto our back and reach up to the ceiling. And then I want you to think kind of like reach up to round in the upper back and then come back down. Bring the elbows to the floor. Reach the hands overhead. Keep that rib cage down. Reach the hands down. Come back to neutral. Press up. And then think round in the back. So we're finding the shoulder blades are spreading apart as you reach up. They're coming together as you come down. And then we're rotating upwards. We're rotating downwards. And then coming back to neutral. So we'll do about 3 more of these. So reach up, round in the upper back. Come down, think squeeze between the shoulder blades. Reach up for that external rotation. Pay attention if one side feels a little bit stiffer than the other. Come down for that internal rotation. Back to neutral. 2 more, reach up. Come back down, think squeeze the shoulder blades. Hands up. Hands down. Back to neutral. Press up, last one, reach up. Come down, think squeeze the shoulder blades. Reach up for that external rotation. Reach down for that internal rotation. Come back to neutral. So let's come over onto our side and come back up to a seated position. So now we're going to move through the banded work. If you do not have an attachment point, I'll show you what this exercise looks like. If you do have an attachment point, we want it to be roughly around like eye level or the top of your door frame. This exercise is going to be our archer row, and then we're going to move into an archer press, and we're going to do it from a half kneeling position. So we're going to come into this half kneeling position. If we're doing the no attachment variation, the band is going to be out in front of you. The hand that is towards the up knee, so right knee is up, I'm holding the band in that right hand. I'm going to exhale to row that band back as I kind of press the hand forward to twist towards my right leg. And I'm thinking kind of this little corner of my rib cage is being pulled in and down as I twist towards kind of like that hip area. So I'm trying to decrease the space between my rib cage and my pelvis. So exhale to row back and then inhale to reach and come forward. Exhale, row back, inhale to reach and come forward. If you're doing the attachment variation, it'll be fairly similar. So I have that half lunge position. I'm going to twist to open up in my body. And then exhale, I'm going to row. Say, pull that rib cage point towards the pelvis. And then go back. So twisting in the upper body. And then exhale to row. Think rib cage towards the pelvis. And then come back. So if you're doing the attachment variation or the no attachment variation, we're going to move through about 10 reps on each side. So reach forward, open up if you're using the attachment, exhale to row, think kind of crunching towards that right hip, and then inhale to come back. So we're adding a rotation in the thoracic spine. We're adding a little bit of lateral side bending. And there's a little bit of rounding as well. So we kind of have all 3 motions of the thoracic rib cage moving here. In addition, we have that scapula kind of moving on that rib cage. About 3 more. Let's go ahead and switch sides. So opposite knee is up, so left knee is forward, holding on to that band with the left hand to row as you reach. So really think about that left kind of bottom of your rib cage half is pulling in and down towards that rib cage. So it's that left external oblique that is twisting you towards your left leg. Two more here. Go ahead and release the band. And so you could do any of those exercises multiple times to help release some tension that you may be feeling in your lower back or your upper back. And I like to incorporate them into my workouts or into my warm-ups and cool-downs, especially on the days where I'm having a little bit more discomfort either in my lower or in my upper back. I hope these exercises help you feel more comfortable in your body as you navigate your pregnancy and in your postpartum. If you enjoyed the workout, be sure to subscribe to our channel so you get notified whenever we release new videos. We release new workout videos on Tuesdays and tons of educational content to support you throughout your pregnancy, your birth, and beyond on our YouTube channel. If you want more of a daily guide with your workouts throughout your pregnancy or postpartum, check out our online fitness programs. We have our online prenatal fitness programs and online postpartum fitness programs to help guide you through either phase of life or both, because you can bundle them together to save 15% off. Check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings to include our bundles. So you can save a total of 25% off all of our courses if you bundle them together. Thanks so much for joining me, and I'll see you next week.